So what I'm going to cover in this session is talk a bit about your rights as a worker, and just touch a bit on responsibilities that we will have under the Health and Safety at Work Act. Talk about how health and safety law is enforced and the powers of the regulator. I'm going to pick up on a few key health and safety issues in the sector, and then we're going to touch on sort of reporting and escalating issues, but I know you've got another session on raising concerns coming up, I think next week, and then look about how you can get more involved. And I think Mel will pick up on some issues around getting more involved in health and safety as a UNISON member. So without further ado, so your rights at work. So next sort of 2 slides, I'm going to pick up on some of the key issues and the key rights that you have as a worker. Hopefully none of these will be major surprises to you, but I think it's really important to reinforce them. So what I'm not going to cover in this session is issues around patient safety. But what I will say is that, you know, where the employer, where the organisation is doing everything they can to look after staff safety and staff health, then that's obviously going to have a positive impact on patient safety and resident safety as well. It's all about having a good health and safety culture. So let's just go through these few bullet points then. So you have the right to work in a place where all risks are properly controlled. So there's duty on employers to assess any risks to your health and safety at work, and there is a duty on them then to reduce those risks as far as is reasonably practicable to minimise any harm to your health and safety. So what that means is, if there's a big risk, if there's a big issue that's going to cause harm to lots of staff, serious harm to lots of staff, then the employer should spend more time and more resources on reducing that risk to as low as possible. So if you're using a dangerous chemical or work equipment that could harm you or the person who's like a hoist who's on the other, you know, being moved by the hoist, then the employer really has to make sure that they're managing any risks of you know, the hoist or the piece of equipment or the chemical causing harm. I'll talk a little bit more about risk assessment as we move along. You have a right to be consulting on matters related to your health and safety. So the employer has a duty to consult workers on matters related to health and safety. And this could be anything like bringing in a new piece of equipment, bringing in a new work procedure, or even something like bringing in a new shift pattern. So if they were bringing in a new shift pattern where you were, your finish time was like 10, 11, midnight, really late at night, there was no public transport, then that, you know, that is something that's a risk to your health and safety. So the employer should be consulting you. Now, of course, we would want them to consult through trade union health and safety reps, where there are trade union health and safety reps. But if there aren't, there's still a duty on the employer to consult the workforce on these matters. And consultation isn't just telling you what should happen. Consultation is a two-way process. So it's giving you information on what their plans are, giving you the opportunity to say, you know, we're concerned about this, we don't like what you're doing, and then responding to those concerns as well. So it should be what we say in good time. And again, it feels a bit strange putting this up here, but you have the right to inform your employer about health and safety issues and concerns. And I put this up here because we know that some workers are told, you know, well, we don't want to hear about that. You know, we don't want you to report that. So absolutely, your employer should let you report health and safety concerns and issues and record them in things like the incident book or online incident forms, and should not discourage you. And in fact, you know, as a worker, have a duty to raise concerns around health and safety as well under the Health and Safety at Work Act. Some other quite specific things. So the working time regulations, the whole raft of rights under the working time regulations, and they are about health and safety because tired, fatigued workers, you know, are more likely to be injured, to be harmed. So they are really important for mental health and physical health as well. And I'm just going to focus in on one. So it's the right to have a rest break of at least 20 minutes if you work more than 6 hours at a stretch, and that's the minimum. Obviously, we would want employers to be putting more in, particularly where the days are longer as well. But absolutely, as a minimum, 20 minutes if you work for more than 6 hours. And that should be away from your workstation as well, from the immediate workstation. And then things like there's regulations around access to rest facilities, washing facilities, and drinking water. And again, where there's a risk of things like food being contaminated, you have a right to sort of eat away from your immediate workplace, your work station, your work office, because you know, infection prevention and control, your food and your you know, could get contaminated if you're being told to eat in a clinical area. So next one, your rights, small rights then. So I think again this is an important one, training to do your job safely, and that, you know, that's part of a risk assessment, and the training should be in work time and free of charge. And also, again, very relevant in the context of the COVID pandemic, the Health and Safety at Work Act and the supporting regulations around protective equipment also say that that should be, where it's identified as part of the risk assessment, it should be provided free of charge. You have the right to stop working and leave the area if you think you're in danger. So this is covered by the Employment Rights Act. So if you're in a situation where you feel you're in what they say serious or imminent danger, you should be able to leave that work situation without any detriment to you. So I'll give an example. So if, for example, you go into a patient's home, there is somebody, a stranger in that patient's home, who's wielding a knife, or who is threatening to assault you, then, you know, if you feel you're in serious and imminent danger, you can sort of withdraw from that situation, call your manager and get support and backup. And there should be processes in place to allow you and to give you information on what to do when you're in those situations. But absolutely, if you feel you're in a dangerous situation, you should be supported by your employer to get yourself away from that situation, and you shouldn't suffer any detriment if you do walk away from those situations. So you have the right, again, to contact the Health and Safety Executive or the local authority, and I'll talk a bit about what those two organisations do. So if your employer is not addressing these health and safety concerns, you can escalate them to the Health and Safety Executive, and I'll come on to that in a minute. And last but no means least, and I'm sure people on this call are already obviously UNISON members, so you have the right to join a union and be a union health and safety representative. So, and again, we'll pick up on that at the end of the session about how you can become a trade union health and safety representative. So just a little bit then, so those rights, and those rights are also employer duties. And I think it's worth saying again, the primary responsibility for a safe and healthy working environment lies with your employer. So that's usually the head of the organisation, so chief executive, director, manager of the organisation, senior manager in the organisation. So they have the responsibility for your safety and health. They can delegate that health and safety management to somebody in that organisation, but they can't devolve responsibility. So ultimately the buck stops with them. They have that duty to assess and reduce the risks to health and safety, as I mentioned. But they also need to appoint a competent person. So they need to appoint somebody to sort of manage day-to-day health and safety, to sort of pull together policies and risk assessments. That can be them themselves, they can do that themselves, or they can, as I say, they can delegate that to somebody. But that competent person must be somebody who has the training, information and skills to carry out that role. I know some organisations bring in consultants from the outside, but it doesn't matter whether it's somebody inside or somebody outside, as long as they have the training and the skills to do those health and safety risk assessments and write those health and safety policies. So that's a requirement on the employers. They need to have a health and safety policy with, if they employ 5 or more employees. And they need to have systems in place for recording accidents. And then there's a whole series of certain types of accidents and injuries that they formally need to report to the health and safety executive. So if somebody's off sick from work as a result of a workplace accident for more than 7 days, that's an example of something that has to be reported to the health and safety executive. They have to display the health and safety at work policy, and then they also have to have employer liability insurance as well, and have details of that made available. I just want to touch quickly on agency and temporary staff, because there is an absolute duty, you know, again, very similar duties to protect agency and temporary staff. And we know the use of agency temporary staff is very high in the sector, and we know our members are also working in agency and temporary roles. So there's an absolute duty for agency employer, the agency organisation, to talk with the host employer where you're being placed, and to communicate and cooperate and consult between the two organisations to make sure that the agency worker is protected. So things that should be happening is information, instruction and training to enable that temporary worker to work safely. That health and safety training should not be should take place during working hours and at no cost to temporary worker. And as I talked about, providing protective equipment at no cost, then that's all applies to agency and temporary workers. Now, who supplies that equipment is again about coordination and agreement between the agency and between the host employer. But it's usually the host employer where you're working that will provide that equipment, because they're the ones who are creating that risk in that environment. And again, ensuring temporary workers know how to raise health and safety concerns and have induction and are shown around the workplace as well. So yeah, just quickly, your responsibilities, so under the Health and Safety at Work Act, so Section 2 and Section 3 of the Health and Safety at Work Act are around the employer's responsibilities to workers, to employees, and also to contractors or people coming into that work environment. But under Section 7, there are responsibilities for employees as well. So I think, again, these are all fairly self-explanatory, and really, you know, it's just to take care of your own health and safety, cooperate with, you know, what you're being instructed to do, follow the training you've been received, and not to interfere or misuse anything provided for your health and safety or welfare. But again, say primary responsibility lies with the employer. Lots of employers have been prosecuted for breaching health and safety, very few employees, and where they have been prosecuted, it's been things like messing around with fire extinguishers, so, you know, having sort of play fights with fire extinguishers, or having racing around forklift troughs, sort of dangerous activity like that. Sort of those are the sort of scenarios where the employer, where the health and safety executive would prosecute an employee. But again, it's that sort of you know, it's those sort of things which we all should be doing day in, day out anyway. Just very quickly mention, so there are responsibilities, obviously, or duties on anybody who's registered with a nursing and midwifery council. So if you're working with somebody who is NMC registered, then they also have those additional duties under their code to, you know, to the safety of colleagues and to the safety of patients and people they're caring for. The duty to tackle and escalate and raise concerns as well. So there is a professional duty on people who are who come under the NMC code. And I think that's important to mention, because if you're working along somebody who've got a health and safety issue which is not being tackled, then again, you know, it's working with somebody who comes under the NMC code, and, you know, their responsibilities under the code to actually raise those concerns as well might be another lever that you could use. So how is the law enforced? So a little bit about health and safety law to start off with. So health and safety law is criminal law. So at the bottom of the slide, we've got the civil law. So civil law taken for negligence. So if you're harmed or injured at work, you know that there is the potential for you to take a case with UNISON solicitors for damages and negligence against the employer. But health and safety law is criminal law, so that's a civil litigation. And health and safety law is criminal law. So the health and safety executive can prosecute employers, can make employers do improve their working environments by issuing them with legal documents. So they do have quite strong powers, and they have more powers than sort of police officers. They can go, you know, they can go into a workplace without a warrant, and you know, they can just turn up at the doorstep of an organisation and inspect. They can go in if there's been reports of an injury, so somebody's been off for more than 7 days as a result of an injury. They can come in on the back of that, or they will sometimes come in on the back of complaints. So if there's been a few complaints coming from one organisation or unions, then they will sometimes come in on the back of that. They do work with a CQC, so they have an agreement with a CQC, so they do share information and intelligence with the CQC, but they are the ones that are responsible for worker safety. Local authorities do also enforce some areas. So again, I can signpost some information about who is the right person to report worker health and safety to, but mainly it's the health and safety executive, although I say the local authority to enforce worker safety in some areas. Obviously not local authority own care, because that, you know, they'd be marking their own homework if that was the case. But they have the sort of same powers to come in and to inspect, follow up complaints, and then they can prosecute organisations where they found failings. Now, I just want to share this case with you. This is an example of a case that the health and safety executive took in the care sector. It's quite a horrendous case, and the organisation was fined as a result of it. But it was a carer who was going into a patient's home, and the carer was sexually assaulted and raped in 2018 while visiting, doing home care on a male service provider. And the key thing about this was actually, and I find this quite shocking, is that the organisation knew about the risks as early as 1994. So female employees or employees were going into that service user, raising concerns about inappropriate language, inappropriate touching, and the behaviours of that individual. And again, the organisation didn't do anything about it, and it ended up in a sexual assault and a rape, which again is absolutely horrendous. So it highlights a number of things. It highlights the risks to lone working carers that are going into service users' homes or alone with service users. It does highlight the powers of the HSE, although, you know, we should never have been, this person should never be in that situation in the first place. The employer had a duty of care to tackle and address these issues when they heard about them first in 1994. And that is a health and safety issue. So again, I'll talk about what employers should be doing about mental health and stress and work demands. That is seen, it's not just about physical health, it's not about back injuries and violence, it's actually also about your mental health as well. Employers, again, back injuries from moving and handling. Employers should be risk assessing those and reducing the risk of injuries in relation to lifting and handling, bending and stretching. Violence and lone working. So obviously that scenario, or that case I just gave you was a lone working example. So the employers should be looking at risk assessing lone working and violence. Sharps injuries, where sharps and needles are being used in the workplace. So doing monitoring blood sugars on people, all the sort of scenarios, they should be risk assessed. Shift work and fatigue. So as I said, shift work and lack of breaks, they're all health and safety issues as well that the employer should be tackling. Cleaning chemicals. So if you're involved in using cleaning chemicals, then again, the employer's required to do a risk assessment on those. And also things like dermatitis. So if you're washing your hands frequently, if you're using cleaning chemicals, if you're using hand sanitizer all the time, and we've all been doing that through the pandemic, but care workers more than anybody else, then employers should be again making sure that you're not picking up work-related dermatitis and reducing the risks of that. So just picking up on those two issues. So COVID safety very much with us. Sort of purpose of this session, I haven't got enough time really to go into it in that much detail, but happy to take any questions or comments. But I think it's worth reinforcing that even with the National Infection Prevention Control Guidance, there is still a requirement on employers to risk assess the environment and the work activity, and then as a minimum put in place safety measures that are within the National Infection Prevention Control Guidance. So they can't just say, well, this is the guidance, that's it. They should be actually doing a systematic risk assessment as well, and identifying all the workers who can be harmed as part of that risk assessment as well. So that may be workers that are more clinically vulnerable, maybe pregnant workers. So they should be picking that up as part of their risk assessment process. And then where risks are identified, speaking to workers and looking to see what other measures they need to be put in place as part of that risk assessment. Ventilation is increasingly important. So we've all now seen the adverts of people going into people's homes where the COVID infection is coming out in people's breath. So it's sort of coming out in particles, it's airborne, telling people to open their windows and ventilate their homes. But that's important if you're going and visiting somebody in their own home or their own residence. But it's also important in sort of care homes and residential homes as well. So the question there is, what is the employer doing about risk assessment for COVID, and are they including ventilation as part of that risk assessment? So ensuring there's circulation of fresh air, or if they have mechanical ventilation systems in place, are they making sure they're not recirculating old air, and are they maintained? And then if there are areas that aren't well ventilated, then looking at how they can improve ventilation through things like air cleaning filters in those environments. Access to PPE, I know that was a real problem at the beginning of the pandemic. Again, as I say, within regulations, where the PPE is required as part of that risk assessment, it should be free and accessible. So I'm hoping that's no longer a major issue. And then again, sick pay and sickness absence policies, so allowing people to isolate is also a health and safety issue. Good sick pay does link in with health and safety, because if you can't afford to isolate, then that's a risk to you, risk to people around you, and say potentially could make COVID spread. Quickly again, sort of mental health and work-related stress, absolutely aware this is a major problem now in the sector, in the health and social care sector. And when we did our survey back in the summer, 68% of our members said their mental health had declined during the pandemic, and 85% of those said that work during the pandemic has contributed to their mental health issues. So it's work that's causing a lot of these mental health issues. So as I say, employers have a duty to assess and reduce risks of work-related stress and mental health, just like any other work hazard. And we know that things like workload, bullying, as well as the trauma from working through COVID are key causes of work-related stress. So again, the health and safety executive, the regulator, would expect employers to be having discussions with staff around what are the key causes of stress, what can we do to tackle them. And I suppose some of the causes I know are linked to staff shortages, so some of that may be sort of a national issue that might be outside the control of the employer, but there's still stuff the employer should be looking at, like things like tackling bullying, looking to see what management support is there for staff, making sure you've got good rest facilities, all those things that can cause sort of kind of impact on your mental health. So employers shouldn't be turning around saying, well, staff shortages, I can't solve that. They should still be looking to see what they can do by speaking to staff and seeing what the main causes are of stress and trying to put some steps in place to reduce them. And again, we've got lots of information on that within UNISON. So just sort of summing up then, sort of last two slides, just really to reinforce, if you have health and safety concerns, I think always formally report incidents and accidents, including near misses or undesired circumstances. So even if something hasn't happened, if you felt that your safety or the safety of your colleagues, or even obviously the safety of a patient was put at risk, then you always report them using your organisation's reporting systems. And obviously, if you've had harm, if you've had an accident, or you've suffered from ill health, so if the skin on your hands is all breaking down because of the chemicals you're using, or because the work you're doing at work, record those incidents, because it's important that the employer looks at them and learns from them and prevents issues happening to other people. But also, if it comes to there may be potential for us to support you with a personal injury claim as well. So it's really important to have that record. And I know it's sort of frustrating. You report something, the employer doesn't do anything, but just really, as a minimum, really try and report everything you can. Have a look at your organisation's policy on escalating concerns, what they're, whether they have policies and procedures in to advise you on how you should raise concerns and what you should do, and what you should do if you're in those dangerous situations in a patient's home, for example. Speak to your health and safety reps and get support from your branch, and then you can obviously report things directly to the HSE, but have a conversation with your branch and get the support of them first, get advice and support from them. And then, as I say, you have the right to stop working and leave if you feel you're in serious and imminent danger. So that is something that you can do. So just some thoughts on, things to sort of take back if you want to sort of look into this a little bit more. Does your employer have risk assessments on the key issues? Are those risk assessments up to date? Are they being reviewed? Are they actually sharing the risk assessments and health and safety policies with yourselves? Well, including agency staff. So our agencies, our members who are working for agencies, are they also given that information? Check on what the policy is, as I say, to report and escalate health and safety issues in your organisation. And don't feel alone. Get support from your colleagues around you, and obviously the branch. So don't sort of ever feel that you're alone. It's just you, because 9 times out of 10 there'll be somebody else who has the same health and safety concern. It's that whole thing about safety in numbers. And then finally, really think about becoming more active. You know, if you're interested in health and safety, I won't steal Mel's session, because Mel's going to talk a little bit about this, but, you know, we really would love you to become a health and safety rep. You don't have to be an expert in health and safety. All you need to be is an expert in work, and what, you know, what your job and your colleagues' jobs are in, day out. Know how how your work is carried out. So we'd really love people to become more active. And then I can share these slides. So it's some signposts to UNISON information on health and safety, UNISON information on coronavirus, and also we've got things like information sheets on ventilation as part of that as well. Health and safety executives' workers' health and safety pages are really good. They reinforce what, you know, I've just said in the first few slides about your rights at work. And then they've got a comprehensive guidance on health and safety in care homes as well, which is free to download from their website. It does talk about sort of patient resident safety issues as well, like sort of hoists and equipment and legionnaires and things like cot sides. It does talk about patient safety, but there's also a lot in there about worker safety, again, mental health, stress, violence. So if you want to sort of delve into it a little bit more, then that's good information to look at. So I'll stop there, and I'll hand back to Mel, and then happy to take any comments or questions.